Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. Subscribe at kevinmd.com/podcast. Today, we have a special sponsored episode from Takeda. We welcome Angelina Collins. She's a nurse practitioner at a large tertiary inflammatory bowel disease center in California, where she specializes in IBD management and treatment. We're going to be discussing evolving Crohn's disease and ulcerative colitis care and her journey and experience as a clinician treating patients with inflammatory bowel disease. Are you a healthcare clinician looking to increase your IBD knowledge? Visit ibdiq.com. That's ibdiq.com to continue to evolve your IBD knowledge for yourself and your patients. The link will be in the show notes. Angelina, welcome to the show.
Thank you so much for having me. I really appreciate it.
All right, so tell me how you became a nurse practitioner who specializes in inflammatory bowel disease.
I think a little bit by chance. I started my NP career, obviously in training, as many others do, for the outpatient practice. I connected with a gastroenterologist, and that was about 20 years ago. Ended up training with him. It was a wonderful experience. We had a great connection, and I started in his community-based private gastroenterology practice. It so and very quickly became really apparent to me that our IBD patients, those who have Crohn's disease and ulcerative colitis, really had a lot of unmet needs. And I just thought, I can help take care of these patients and I can help them in their journey and advocate for them. And so over time, I just tried to gain as much knowledge as I could. The more you gain, it's like a rabbit hole, as you know, in many medical areas. The more you know, the more you want to know. And I just was really ready to take that challenge on. So after 11 years in that practice, I was offered a position at a large tertiary care practice center, just specializing in IBD. And I've been there for almost 8 years now. And all I get to do now is just, focus on my passion, which is helping people with ulcerative colitis and Crohn's disease.
All right, fantastic. IBD is a progressive inflammatory disease that is unfortunately associated with a delay in diagnosis. Why is that?
I think there's probably a few different reasons. One thing that can happen is because the presentation of the diseases can be heterogeneous, meaning there's not one particular thing that tells people, oh, this is the disease. That can really cause some difficulties. One is that the people who are experiencing those symptoms may not really understand, like, this is something serious that needs to be managed, especially if it's coming on intermittently, right? So if it's a symptom that comes and then goes and then comes and goes, but there's time in between, it can be hard to really recognize that warrants a further workup. Sometimes what happens too is that often people with, before they're being diagnosed with ulcerative colitis or with Crohn's disease, they may be seeing a primary care provider. Many people do. The primary care provider may not recognize some of those symptoms or may not send off for a speedy evaluation with gastroenterology. So that can delay the diagnosis as well. And then, whether some people in different areas may not have access to a specialist, right? We know specialty practices are impacted. We know that it can be difficult to get to specialty care, and that can further the delays. And then the last one is really like an overlap of those symptoms, like I mentioned before, that there is not one particular symptom that is automatically going to tell someone this is Crohn's disease or this is ulcerative colitis. There's clues, right? But because there's not just one symptom that you're looking for, there's an overlap with the symptoms of Crohn's and ulcerative colitis and other, disorders and diseases as well. And that can sometimes be vexing for people.
When it comes to IBD, what are some of the challenges you're seeing in diagnosing Crohn's disease and ulcerative colitis?
Yeah, that's really a good question because I think the challenges in diagnosing Crohn's and ulcerative colitis really has to do with the fact that the symptoms are not the same for every person. So I always say, and I'm sure you do in your line of work too, like no matter who we're seeing, these are really unique people and their presentations can be unique as well. And sometimes, as I mentioned, that the symptoms can really be insidious. So you just may not, it may come on or evolve over time, and that can be a challenge. There's a group of people too who will have silent disease, so to speak, until the symptoms become really problematic. So if that's happening, they may have active inflammation, but they're not really having a lot of noticeable symptoms until it really becomes a problem. And then retrospectively, sometimes we understand then, it's really been simmering for a period of time.
So, what do these challenges mean? Why does it matter for people living with Crohn's disease or ulcerative colitis?
Yeah, I think that's a great question. And so for people that are living with Crohn's disease and ulcerative colitis, that delay in diagnosis can really be important. There's leading information working up that tells us that early diagnosis and early effective intervention, as close to that diagnosis as possible, can really predict better outcomes long term. So that can have a significant impact. And then also just thinking about, mental health and thinking of somebody
Mm.
suffering with symptoms, not getting a timely diagnosis, not knowing what's causing those symptoms, I think that can be a real challenge as well and just lead to additional, difficulties, for that individual person that can have an impact on not only their life and their quality of life, but every other facet of life that their symptoms are really impeding upon and causing those challenges. So absolutely. The other thing that happens too is that over time, if that diagnosis isn't made early on, disease can progress. So if disease is going to progress, that can lead to additional complications. It could be a worsening or a more severe disease presentation that can lead to things like hospitalization, which obviously is a really significant outcome, and even lead to other types of disease complications like strictures or fistulas, nutritional deficiencies, iron deficiency anemia, all sorts of things that are, included in the disease, but some people might think about, in some ways, like even peripheral things to the
Mhm.
disease. So I think those are all really important aspects and why timely diagnosis and really timely referral is so critical for ulcerative colitis and Crohn's.
You're listening to a special sponsored episode from Takeda. We're talking with Angelina Collins. She's a nurse practitioner at a large tertiary inflammatory bowel disease center in California, where she specializes in IBD management and treatment. Are you a healthcare clinician looking to increase your IBD knowledge? Visit ibdiq.com. That's ibdiq.com to continue to evolve your IBD knowledge for yourself and your patients. The link will be in the show notes. Angelina, what is the latest thinking on best practices to help close the diagnosis gaps with the goal of earlier intervention?
I think one of the most important best practices to help close the gap from symptoms to diagnosis is really recognition of red flag symptoms and getting timely referral to specialists. So, because these are complex and chronic diseases that we don't have a cure for, and that the chronicity of the disease can lead to worse outcomes if not managed and treated effectively, it's really important to kind of think about those things where we might be including ulcerative colitis or Crohn's disease in the differential. So things like nocturnal stools,
Mhm.
rectal bleeding, unintentional weight loss, anemia, particularly iron deficiency anemia, those would be things to think about as well.
Based on your experience, could expanding IBD knowledge among healthcare clinicians, particularly in diagnostic approaches, help close existing gaps?
In my experience, I think continuing to increase IBD knowledge amongst healthcare providers, especially in the important area of diagnostic approaches, can absolutely help close gaps in diagnostic practices and delays in care. So there's resources such as IBD IQ, Takeda's project, which offers on-demand web-based education at no cost in collaboration with IBD specialists to help healthcare providers at all experience levels. I think the nice thing about this is being that it's web-based, it really gives options even for physicians, clinicians, advanced practice providers in particular, who are interested in learning more about IBD. And it's done in self-learning modules so that they are small snippets of time that you can spend learning different topics. One of the topics I speak about in depth of many of these that we've discussed in today's podcast on the presentation of IBD, challenges of timely diagnosis, differential diagnoses, and approaches to IBD management as a whole. But there's several others, and it may be a great opportunity for people to dive into IBD.
What is the latest thinking on best practices when it comes to an appropriate patient care model?
I think for me, the patient care model ideally first would include a multidisciplinary team that has
Mhm.
really in-depth knowledge of IBD. This doesn't mean that each patient has to be cared for at a specialty or a referral center, especially keeping in mind that I started my, GI practice in a large community-based practice. And I think wonderful care can happen everywhere, right? But what it means about using a multidisciplinary team in my mind is that depending on where you are, you may have to create your own network of providers who are really knowledgeable and can help manage the varying challenges of IBD. So that can mean surrounding yourself with people that can really help the
Mhm.
patient to navigate. So not just those that are within your practice, thinking of the obvious types of things. You need a gastroenterologist. Of course, I think every team needs an advanced practice,
Yeah.
nurse practitioner or a PA who specializes in IBD or has in-depth knowledge on IBD for best care. But then you also need a nurse, you need a patient navigator or someone that can help the patients get to medications or, help through the authorization processes. You need a pathologist who's really a GI trained pathologist in my mind. Having a radiologist that's really familiar with reading certain studies like, CT enterographies or MR enterographies that are inherent to how we diagnose, and then not just diagnose, but also monitor and track disease progress over time. A surgeon that you can trust and you can call on, and ideally even having somebody who is really knowledgeable with nutrition. So a
Hmm.
dietitian would be fantastic. A pharmacist is really wonderful to help navigate. We're lucky enough to have a couple of pharmacists in our practice, and that really has helped us quite a bit. So again, it doesn't mean that everyone's sitting in the same room at the same time seeing patients. It means that these are people that you've identified as your team players and you can phone. It's like I call this like phone a friend, where
Hmm.
if you need to collaborate.
So I want to talk a bit more about the role of advanced practice practitioners in IBD care. The Bureau of Labor and Statistics forecasts a 40% increase in the demand for nurse practitioners and physician assistants between 2023 and 2033. Going beyond the statistics, what is your perspective on the growing role of advanced practice practitioners?
I've seen a lot of, increased changes and
Yeah.
increased ability for APPs to help with patient care since I've been a nurse practitioner over the last, 19 years. And I think it's been wonderful because APPs have really demonstrated their knowledge and their ability to deliver high quality, cost effective care and to be part of that team. And I think being recognized as their active roles and in the management of patients, I think is really important. When it comes to GI, I think most practices have already embraced and
Hmm.
integrated APPs into their practices. So I think that has been a key driver of care and a key game changer. Where APPs are being utilized, often they're in the clinic seeing patients, and often the gastroenterologist is scoping or performing
Hmm.
procedures, which I think makes a lot of sense. But the whole idea is to really like embed this. I really seen this as a team-based care delivery model where you get the best out of it when the APP and the gastroenterologist have time together, to talk, to review patients, to, consider complex patient care and things like that. And I think that's really an important aspect of the collaborative approach to IBD. Really, I tend to think of IBD as like it's a team sport.
Yeah.
There's a lot of different players that you need, and we can really deliver the best care when everybody is focused on the game of really helping our patients and advocating for our patients.
And my last question, Angelina, let's end with some take home messages that you want to leave with the Kevin MD audience.
So the messages to leave with, especially if we're thinking about, what can we all do to kind of recognize Crohn's disease and ulcerative colitis, I think it's going back to those red flags. I'd really love for everyone to take away, if you're talking with a patient and you're wondering about symptoms or thinking about a differential diagnosis, if they have any of the red flags of nocturnal bowel movements, if they are having rectal bleeding, if they have unexplained iron deficiency anemia, if they have unintentional weight loss, I think those really need prompt referral.
You've listened to a special sponsored episode from Takeda. Are you a healthcare clinician looking to increase your IBD knowledge? Visit ibdiq.com. That's ibdiq.com to continue to evolve your IBD knowledge for yourself and your patients. The link will be in the show notes. Angelina, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Dr. Kevin.